Our voting session. Did I do it again? Okay,
No, you weren't on. I put your mic on.
okay. Today is Thursday, March 14th, and we are beginning a voting session in the Senate Finance Committee. And we're going to start with Patrick.
Senate Bill 614 is the first bill on the list. This is the bill, you've got a reprint in front of you. This is the bill that expands Medicaid and private health insurance coverage for orthotic device or for orthoses and prostheses. The bill has been amended to be limited to expand coverage for prostheses only, which substantially reduces the fiscal note. And so I'll just running through the reprint, I'll show you where these amendments are reflected. On page 2, we can see that this is prostheses only. Provisions relating to orthoses and expanded coverage for those have been struck from the bill. We have a definition of prostheses here that's been brought into the bill. There's a limitation on coverage for prostheses to once annually. Again, also to address some of the fiscal note concerns that the health department has requested. On page 6 of 9, here's the language that relates to coverage of replacements. There's some clarifying language here that carriers have to cover replacements, but these requirements don't apply when the degraded condition is due to misuse. The MIA has provided some technical feedback. There were a number of provisions in the bill that I think were brought in from some model language elsewhere, and they're either unclear or unnecessary. So, for example, language has been struck that would have these covered benefits treated as if they're habilitative or rehabilitative benefits. That was viewed as really an unclear provision by MIA. There's some alterations to some of the cost sharing protections in the bill, so that under the bill it says that the copay or coinsurance for these prosthetic prostheses may not be higher than other similar medical or surgical benefits. On page 7 or 9, this is 7 of 9. This is where, you know, that coverage expansion is in the bill for this whole body health purpose for a prosthesis. And so you can see here that there's just some clarifying changes. Again, some provisions below have been struck that pertain to some protections against discrimination and also provider networks. So these protections are already in Maryland law and other places. The network adequacy requirement here has been modified just so that it says that a carrier that uses a provider panel for a policy or contract and the provision of the covered benefits under the bill must comply with existing network adequacy provisions. And then there's some intent language here just to make clear that we're not asking Medicaid to cover some additional L codes under the healthcare common procedure coding system. That was a clarification that they requested for. And then below, there's just some reporting. There's an evaluation of the cost impact of requiring coverage for a broader set of orthoses that's going to be requested from the Maryland Healthcare Commission and the Maryland Department of Health.
Second.
Thank you, Patrick. Thank you for all your work. And this does match the House now. So it's the same language as the House, and we've changed the title, taken out orthosis from the title and added so everybody can move. So we have a motion. Did I have a second? A second motion, a second. All in favor of Senate Bill 614? Just think of that little boy running into home base.
I was going to ask about, does this help them?
Senator Reedy, were you voting? Thank you. No, that's fine.
Thank you all. It help them. It will help them.
Yep. Senate Bill 697. This is the Maryland National Guard TRICARE Premium Reimbursement Program bill. The bill repeals a $60 monthly cap on a grant award that the military department may provide to an eligible recipient under the program. I think what became clear was that the military department was looking for more flexibility in allocating the grants. but did not intend to have a fiscal impact from the bill. And so what the amendment here does is it just specifies that though that cap is being removed, the total amount of grants awarded to eligible recipients in a fiscal year may not exceed the annual appropriation in the state budget for the TRICARE premium reimbursement program. So this takes care of the fiscal note issue.
Move favorable. Second. Back to your vote.
Quickly, just back on 614, can I be added as a co-sponsor to that? Is that they were constituents? Yeah, on SB 614, so everybody can move back. They were,
Let's vote.
Okay,
697.
thank
We have a
you.
motion and a second on 697. All in favor of TRICARE? Is it a unanimous vote? Okay. So you would like to be added as a sponsor on
SB
614?
614, please. Thank you. Thank you.
How many people want to be sponsors on 614? I love it. Senator Ellis, Senator.
Everybody.
Okay, thank you.
And the same for 697 for me, Madam Chair.
Same for 697. You want to be added?
Yes.
Me too. One.
And add, who wants to be added on 697? We got a pile on?
For our national.
No?
guards.
Okay. Ellis, Reedy, Passmeyer, Vidal, Hershey, and Lamb. Thank you. We got it. Okay, Patrick.
Okay.
All right, let's keep moving. Patrick.
Senate Bill 855. This bill has been, so this is a local Washington County bill. You may remember there was some changes in the bill to the criteria for the board of members of the Board of Licensed Commissioners and Board of Community College Trustees. What the amendments do here is it strikes provisions that pertain to the Board of Community College Trustees for Washington County. So these changes would only apply to the Board of Licensed Commissioners. And under the bill, the membership of the board must be based on the results of the preceding election of the Washington County Board of County Commissioners. So specifically, two members must belong to the political party that received the highest aggregated number of votes, and one member must belong to the party that received the second highest aggregated number of votes.
Move favorable.
Are you moving? Senator Ellis said favorable, you'll be second. Okay, all in favor of this local bill that they supported the amendment. Okay, unanimous vote. Thank you.
Okay.
On the way out the door. Okay.
Yeah, so Senate Bill 891, this is the Mobility Link Paratransit Service Improvement Study Bill that was heard yesterday. This is the bill that requires the Maryland Transportation Institute at the University of Maryland to conduct a study to identify methods to improve MTA's Mobility Link Paratransit Service. So that there's some requested amendments from Disability Rights Maryland that the sponsor, Senator McCray, is interested in accepting. And so these amendments before you reflect those requests. One would require input and comments from the public and riders of MTA's Mobility Link Paratransit Service in consultation with the Maryland Commission on Disabilities and the State Coordinating Committee for Human Services Transportation. It would also have the study develop recommendations for service improvements to individuals located at least 3/4 of a mile from a fixed transportation route, and then develop recommendations to address interjurisdictional restrictions to paratransit services. And then one other thing, the report would go to the Maryland Department of Transportation.
Patrick, there was a letter today from the MTA that they are under Department of Justice investigation for complaints. And they asked to actually be the lead on the study. Did you see that?
Sure.
Okay, and I asked the sponsor and he said it would be okay. But I don't know if we want to make them the lead on the study or add them to the study.
So what they say in their letter is that the MTA would request to be the responsible party for conducting a study on mobility improvements. They are undertaking an internal study of mobility. So I think what their view is that they already are undertaking an internal study of mobility that's going to begin in spring 2024 and fall and be completed in fall 2024.
Okay.
And so I'm not sure if they're if their request is to be substituted as the entity that's doing the study here,
Okay.
but rather, that they want to maintain control over the study through their internal one that they're doing.
Okay, so they do have control of their internal one. We're not doing anything to change that, are we? That
And this would be a separate study that the
separate
University
study.
of Maryland
Okay.
is doing.
I'm fine with that.
Secret plan to fix the grant facility.
Okay. Motion,
That, move favorable.
Second.
all in favor of the Senator Craig's bill, the amended bill. Unanimous vote, thank you.
Oh, never mind. So next on the list is Senate Bill 516, which as amended establishes the Maryland Aerospace and Technology Commission within the Department of Commerce to promote innovation in the field of space exploration and commercial aerospace opportunities in the state. So the bill specifies the membership of the commission, requires the Department of Commerce to provide staff. The commission must designate aerospace and technology zones, develop and annually update a strategic plan and promote educational opportunities. There are some amendments that alter the membership of the commission, strike provisions related to the establishment of an associated special fund, grant program, advisory committee, and specific staffing requirements within the commission. And the amendments also situate the commission within the Department of Commerce, as I've described.
Motion is second.
All in favor of Senate Bill 594? I'm sorry, Senate Bill 516. All in favor? Thank you. Unanimous.
So next is Senate Bill 594, which as amended and shown in the reprint requires the Department of Health in consultation with relevant stakeholders to study the impact of requiring Medicaid to provide comprehensive coverage for the treatment of obesity and report its findings by December 31st of 2024. The amendments strike the bill as introduced and substitute the study.
Move favorable.
Couldn't get around the $1 billion fiscal note.
And a second, thank you. All in favor of Senate Bill 594? It's a unanimous vote. Thank you.
I would like to be.
Senate Bill 751 requires the Secretary of Health within 6 months of as amended and shown in the reprint. Senate Bill 751 requires the Secretary of Health within 6 months of receiving specified findings and recommendations from the Opioid Restitution Fund Advisory Council to present to the Advisory Council the Secretary's decisions for allocations from the Opioid Restitution Fund. The Department of Health has to post on their website the council's findings and recommendations and the secretary's decisions. And the bill expands the permitted uses of the fund to include supporting community-based nonprofit recovery organizations that provide non-clinical substance use support services. So the amendments alter the timing of the secretary's presentation of decisions to the council, clarifies the community-based organizations supported by the fund. The amendment also strikes provisions requiring that a certain percentage of the fund be used to support community-based organizations. That's found on page 4, and strikes an annual report. And then the last thing is that the amendment requires the department by December of 2024 to report on the best process for making expenditures from the fund accessible to the public. These are consensus amendments developed by advocates with MDH and are also applied to the House bill.
All in favor of the amended bill? Senator Reedy, you okay?
Yeah.
Okay. Unanimous vote. Thank you.
So next is Senate Bill 790, which as amended alters the requirements for Medicaid employed individuals with disabilities, also referred to as the EID program, by largely codifying current practice. So among other provisions, the bill requires the Department of Health to provide EID services to qualified individuals as young as 16 and establish premium contribution requirements for program services. The department is prohibited from limiting eligibility based on specific income, asset, or Social Security disability insurance benefits statuses. The department is also required to meet with certain advocates at certain intervals and apply to CMS for any necessary alterations to the state plans. So the amendments offered by the bill sponsor strikes provisions related to transitioning between EID and Medicaid services, further strikes provisions related to establishing specific premium contributions, and finally strikes a provision prohibiting the department from establishing an upper age limit.
Move favorable. Second.
All in favor
Hmm.
of Senate Bill 790?
Yes.
Unanimous vote. Thank you.
Madam Vice Chair, may I be a co-sponsor on this bill?
You
This
may.
pro-family?
No,
You said no?
no, yes. of
Yes.
course you can.
Yes, Senator Ellis. you
Yes,
can.
thank you.
Thank you.
Next bill is Senate Bill 795, which alters the definition of practice audiology, specifying activities that are included and not included in the definition. So generally, practice audiology means to evaluate, diagnose, and treat auditory or vestibular conditions in the ear and to prescribe, order, sell, dispense, or fit certain assistive devices. The amendments narrow the definition of practice audiology by striking language authorizing the use of, quote, any means known in the science of audiology, end quote. So that's found at the top of page 2. They further limit the removal of a foreign body or cerumen from the ear canal to instances not requiring anesthesia, and further limit certain testing and imaging to instances related to the auditory or vestibular condition of the ear. There is no fiscal impact.
Move favorable.
Second, okay. Senator Lamb has a question.
Yeah, I think it came up during the hearing that they were trying to model it after the optometry parts of the statute, but I think even with these amendments, they don't quite mirror the optometry parts. There's still a lot more that can be done under this draft as amended that go beyond what like optometrists are allowed to do. And so we're waiting on some amendments that we'd like to get back. I know the House has, they heard it in subcommittee over there, and I think Delegate Rosenberg said that they should still be able to meet and get this through crossover on the House side. So like to be able to hold for the amendments.
Sponsor, is that, can we hold it for the House amendments? Thank you.
Next bill is Senate Bill 843, which modifies the way occupational deafness and hearing loss must be calculated for purposes of workers' compensation benefits by one, increasing the number of frequencies that must be included in the calculations, and two, altering how age-related non-occupational deafness is calculated. There are some amendments that apply the same frequencies to provisions that are specific to hearing loss due to industrial noise. So that can be found on page 1. And then further strike from the bill provisions related to tinnitus or tinnitus. These amendments align the bill with the cross file that's moving in the House.
Move favorable.
And-
Favor of Senate Bill 843. Unanimous vote. Thank you.
So next is Senate Bill 896, which establishes the Baltimore Convention and Tourism Redevelopment and Operating Authority Task Force to study the establishment of an entity or strategy to govern and redevelop, revitalize, construct, design, manage, finance, and operate certain state and local real property assets while promoting the Baltimore Convention's site and the immediate surrounding area. So the Department of Commerce must provide staff to the task force. There are some amendments from Senator Hayes that add members to the task force, alters the scope of the study, requires the task force to consider and make recommendations on at least one option that does not include a public-private partnership or the status quo. The bill and the amendment have the support of the delegation.
Second.
Second, all in favor of this delegation bill? Unanimous vote.
Sir.
Senator Washington did bring up today, and if you could look at it before it comes to the floor, just so we can have an answer to it. She thought that we couldn't say an African-American business, but it had to be like a representative from an African-American group or something. Can you just check that before it comes to the floor in case she asks it? So we'll be prepared to answer it. I don't need the answer now.
Okay, and maybe after the
Yeah.
voting session, I can just jot down specifically the question. Thank you. Next on the list is Senate Bill 944, which one repeals a criminal prohibition against selling or offering for sale a non-latex condom by means of a vending machine or other automatic device, while establishing a prohibition against the sale of a natural membrane condom under the Health General article. Two, the bill requires a certain formulary used by registered nurses to include additional information on non-prescription contraceptive drugs and devices approved for over-the-counter use. And then three, authorizes a registered nurse to provide non-prescription drugs and devices without a prescription in compliance with current law. So the bill also makes some conforming changes. The amendments strike a provision that would have repealed a prohibition on selling contraceptive devices by means of a vending machine at specified school sites. So that provision remains in current law. And the amendments also prohibit a person from, as described, selling or offering a natural membrane condom. There is no fiscal impact.
Can I get a second? Thank you. Got a motion in a second? You can ask me that.
So this bill now, as far as vending machine contraceptives, this doesn't touch anything that's current law about what's allowed to be sold except for condoms in vending machines, correct?
Didn't they say the new birth control pills that'll be approved like this week?
So the
Yeah.
vending machine provisions are only related to condoms.
All right. And then the new birth control stuff, the new birth control pills that are coming online, what does it have to do with that?
It would be related to the authorization for a registered nurse to, the specific language is registered nurse to provide non-prescription drugs and devices without a prescription in compliance with current law.
They already do that though, right?
So this is a clarifying, some of the testimony was that some people think that it would be appropriate, however, they wanted this clarification in the health occupations article.
Okay.
It's
But
not
it's,
related.
but
to
it's
vending
not
machines.
adding anything to any scope of practice or anything like that. Okay. All right. I was just double checking that. Thank you very much.
All in favor of Senate Bill
Right.
944?
Where are they located?
Do I have a unanimous vote?
So the school provision, this is
All right.
stays in current law.
No, I don't have a unanimous vote.
I don't know, we'll be all right.
You're okay? All right. Unanimous vote. Thank you.
We'll be okay. We'll come back.
It's on. Okay, the first bill on your list is Senate Bill 59. This is Senator Ellis's bill. It has been amended to be identical to House Bill 177, requiring a hospital prior to discharge of an infant to provide oral and written instructions to an infant's parent or legal guardian on the importance of and how to provide a safe sleep environment. So it's amended to be identical to House Bill 177, which is already here. And there's an additional amendment up top. If you see the reprint, that Senator McCray is being added as a co-sponsor to the bill.
Second.
All in favor of safe sleep? Senator,
If the sponsor's okay, I would like to add my name to the bill as well.
I would like to too. All right. Who wants their name added to Senate Bill 59? Raise your hand. Antonio, did you want? Okay,
You
and
know.
everybody except Senator
Everyone,
Hershey.
not Hershey.
Not
Okay.
Hershey. Okay.
Okay,
Okay, come on, we're getting there.
okay, the next bill, it's Senate Bill 84, and I think the committee needs some special instructions for this bill
Okay. I'll
from the
take care of that.
chair.
This bill did not pass. We had a 5-4 vote and we must have 6 votes. Pardon me? Well, it has to come from the
Prevailing.
prevailing party, which is not us, is not the 5. It's because the bill didn't pass. It has to come from the losing side. We've been investigating this, so if someone would like to make the motion that did not vote for the bill.
Oh, voted no.
Yeah, someone who did, right, who voted no for the bill. So, yes,
I move to reconsider the vote in which this committee voted for that bill, for SB 84.
Okay, so you had voted no on the bill.
Correct.
Okay, so you're moving to reconsider the vote.
Correct.
All right, do I need another motion for
We need a
that?
second.
I need a second.
Second.
Okay, and we have a motion and a second to reconsider the vote on Senate Bill 84.
And then you need a vote.
And now we need to vote, and I think we should call it.
Can you do it after the day? Never mind, go ahead, go
It-
ahead.
it-
You can, it's not specific. Okay,
Yeah.
go ahead, sorry.
No, this is the motion to reconsider the bill. Yeah,
This is the motion to reconsider the
bill. Yes.
That's all we're voting on
Yes.
Okay.
Yeah. Oh, yeah. We need to go.
Okay, we have a unanimous vote to reconsider.
okay, so now you need a motion. You need a motion on the bill.
Favorable?
Favorable.
Okay, okay, we have a motion favorable.
Got more information. We'll let them know.
Okay. Madam,
It's just favorable.
It's favorable with amendments.
favorable with the amendment. Okay. So. you
Senate
call
Bill
roll.
84 favorable with amendment. Vice Chair Fossmeyer.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Hayes.
Yes.
Yes. Senator Reedy.
Yes.
Yes. Senator Ellis.
Yeah.
Yes. Senator Washington.
Yes.
Yes. Senator Guile. Yes. Yes. Senator Lamb. Yes. Senator Hershey.
Chair said,
Yes.
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 What a difference a week
Unanimous
makes.
vote. Ten.
Okay, the next bill on your list is Senate Bill 511. This bill is amended to just be a study that requires, you have a reprint in front of you that requires the Maryland Department of Labor to study non-traditional apprenticeships in the state with a focus on mentorship ratios and occupations that could benefit from involvement with apprenticeships. Again, the bill is struck and it is just a study, and you have the reprint in front of you if you wish to see the details of the study.
And we have a second, Senator. Second. Yeah, I have a question. We've had concerns from labor about this study. Can we add representatives from labor on this, Who's studying it?
It's not a commission or anything. It's just
Okay.
requiring the department to study.
So they would have input.
They could get input from whoever they wanted to.
Does it have a bill in the House?
The bill in the House is, I don't know how it's being amended, but this,
With the same amendment.
oh, it's being with the same amendment?
Okay.
Okay.
Okay. So do we have a motion and a second on Senate Bill 511. All in favor? It's a unanimous vote. Thank you.
Okay.
You told me they were concerned for labor. I'm like, yes, I'm for it.
Okay, the next bill is Senate Bill 537. This bill is amended, prohibits a political subdivision from adopting an ordinance, or not amended, it as introduced, it prohibits a subdivision from adopting an ordinance establishing zoning requirements for licensed dispensaries that are more restrictive than zoning requirements for licensed alcohol beverage dealers and licensed growers cultivating cannabis outdoors that are more restrictive than zoning requirements for hemp farms. The bill also clarifies an existing provision regarding the location of licensed dispensaries and specifies what unduly burdened means as it appears later in the bill. You have a reprint in front of you. The amendments modify the zone, and this is this all moves in Senator Bailey's bill regarding his issue in Southern Maryland. It modifies zoning exclusions for cannabis licensees that were operating under the legal sale of adult use cannabis. So this was his amendment to his bill. And further clarifies the exclusions for outdoor cultivation by specifying that the area must be zoned for agricultural use. It also, Amendment 2 authorizes localities to increase the distance between dispensaries to 2,000 feet and makes other clarifying changes.
Second. Okay, we have a motion and a second. Senator Hershey, question.
Thank you. It was 2,000 feet from each other, right?
Yeah,
To
it
dispensaries.
authorizes, the existing was 1,000 feet. It authorizes localities to go up to 2,000 feet.
Okay, and then there was a concern about how close to residential units they could be. What happened with that?
Well, that is not in this bill.
It's not in here at all? It never was?
It was never in the bill, no. This bill is now amended as to look like the House bill, which is coming over here, or maybe here already. That amendment was offered on the floor over there and it was rejected on the House, but it's not in this bill now.
Okay, so there are no limitations on how close a dispensary can be to a residential unit?
In this bill, no. Certainly, local zoning hasn't,
Is it in current code?
there's nothing in code about how close they can be. The only limitation in existing law is 500 feet, pre-existing primary, secondary school, or a licensed childcare center or registered family childcare home, and a playground or playground or center or library. So it can't be within 500 feet. A new place, or again, 1,000 feet from another dispensary. But this bill would be amended to allow local governments to go up to 2,000 feet. And it also, the bill's introduced, there was some concern about the language here about how far local governments can go, and it specifies that they can't go beyond the limit here in the bill. They can only go less.
I'm sorry, you're not finished.
I'm just still concerned that there are, I mean, if there are no limitations on how close it can be to residential. And,
All right, I want to hold the bill.
okay.
Okay. Senator Lamb.
Can I change my vote on a prior bill if it doesn't change the outcome? Just want to change my vote to no on 511.
You have to motion to reconsider.
Commissioner.
All right, that makes it 9-9. Okay.
It's labor.
It's labor's not happy about that, but anyway, 9-1.
Okay.
Okay.
Hey, the next bill on your list is,
Getting close to being done. Let's
Yeah.
let's stay focused. Go ahead.
the next bill on your list is Senate Bill 651. This was held twice now. I don't think I have to describe what it does.
Okay. Okay, let's vote on Senate Bill.
It's favorable with amendment.
Favorable with amendment.
Senate Bill
651.
651, favorable with amendment. Vice Chair Klausmeier.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Hayes.
He took a walk.
Senator Reedy.
Pass.
Senator Ellis.
Yes.
Yes. Senator Washington.
Yes, but in explaining my vote, Madam Chair, I did talk to my county about it, and some of them reassured me that they can still have their fines if they wanted to for it, which is good for us. So I just want to make sure that it didn't change the process in which we're doing. So thank you. I vote yes.
Vote yes. Okay. Senator Guile.
Yes. Senator Guile, yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
Nope.
No. Senator Reedy.
No.
No. Madam Chair.
Yes.
Yes.
So what's the vote? 7-2?
Yeah, 7-2.
7-2. Bill passes. Okay, this is a new one for us.
This is a new one. This is Senate Bill 723, and as amended, the bill requires a manufacturer of baby food beginning in January 1st, 2025 to test a representative sample of the final product for each toxic heavy metal listed in the bill. Testing must be conducted by a proficient lab at least once per month, and beginning January 1st, 2026, each manufacturer of baby food must make information publicly available on their website in the baby food product label. The bill has 2 amendments, and these are amendments that have been added to the House, and I believe as amended in the House, there is no opposition to this bill anymore. They add definitions, prohibit a person from selling, distributing, or offering for sale baby food in the state that contains toxic heavy metals that exceed limits established by the FDA, and require a manufacturer to conduct certain testing and include information on product labels, and requires consumers to make certain reports to the Maryland Department of Health if they feel that there are toxic metals in their baby food.
Move favorable.
Second.
You have a question?
I have a question. I have an amendment real quick.
Okay.
Okay, my amendment says baby food does not include infant formula. That's basically it.
Okay.
It's food, not formula.
Okay.
Can we take that as a verbal amendment?
What's the difference?
Baby food is food and formula is liquid. It's
It's two different things.
I mean, I kind of don't want heavy metals and formula too, but.
But I don't, but that's usually, yeah.
Some of the metals they find in food are from the soil that, when they're growing the vegetables. And because the vegetables grow in the soil, that brings in some of these other elements. We don't have that with formula. It's
And-
not the same.
This whole bill was taken from the California bill.
Yeah, that makes it right.
Yeah, that makes it really good. But
Give Senator Benson
But-
a bill.
this one little line was left out of the bill by mistake.
Who gave you the amendment?
The- John Steerhoff and Marta. But they checked with Senator Benson, is that correct?
In support of, I think, the amendment, not knowing really anything, but just assuming there have been problems with baby formula shortages. There's other issues, and I don't think anybody's saying there's toxic metals in them in formula, but it's just, you don't want to mix these two up. There's maybe a different testing regimen and some of
Yeah,
that, so.
Thank you.
It's apples and oranges.
So we're amending the bill, separating formula. So the amendment will say it does not apply to formula. All in favor of the amended bill? What's the number?
723.
All in favor of 723? Senator Hayes, are you with us? Okay. It's unanimous vote. Thank you.
Okay, moving right along here, Senate Bill 910 was heard yesterday. This bill requires the Governor's Workforce Development Board to conduct a study on approaches to advancing skills-driven education and training, hiring, and internal advancement practices across public and private sector employers. The study must examine and identify opportunities to advance skills-based hiring and recommend methods for skills-based hiring, education, and training practices in the state. You have a reprint. There are two amendments offered by the sponsor. The first amendment is technical. Amendment 2 clarifies and adds additional data to be collected. And Amendment 3 makes the bill contingent on funding in the budget. The Senate included $150,000 in the budget. It has to go over to the House, but the bill does make there is an amendment that makes the bill contingent on funding in the budget.
Favorable. We have a motion favorable. Do we have a second? Senator Ellis seconded. All in favor of Senate Bill 910? I know, scary. All right,
Okay.
unanimous vote.
Okay, Senate Bill 952. This is the Assisted Living Refer Bill. You have a reprint in front of you. It establishes additional requirements that apply to assisted living referrers. The referrer must maintain general liability insurance, require employees to obtain a criminal history records check, sign a federal health insurance portability, and other things. I'll just go straight to the reprint. There's a couple amendments offered to the bill from the sponsor and also from the chair. If you go to page 2, you'll see that there's a slight change to the HIPAA language to conform with current practice. If medical information is exchanged, it requires the referrer to sign a document with a client or the client's representative in accordance with HIPAA, not from a document for HIPAA, because there is no such thing. Also, on the language, there was language in here requiring written agreements between the referrer and the client. It's modified to say that shall maintain an electronic or written agreement between the assisted living referrer and the client or the client's representative. If you go to the bottom, the sponsor offered language striking visits to programs. And if you go to the next page, the chair is offering an amendment to increase the program referral fee to 2 years instead of 1 year. And then there's an amendment from the chair, which says that the referrer cannot sell the client or client's representative's data to another person, and it modifies the use of the database managed by OHCQ.
Favorable. I just want to clarify, David, I want to get this on the record that Tammy, that this is for all contracts going forward from October 1st, 2024. So it doesn't affect any current agreements or contracts.
You could clarify with prospective language, but generally speaking, when you pass a law like this, it's usually going forward. But we also have provisions that we can add in uncodified language saying it is, if you want to be that explicit. But that's
Well,
generally speaking.
I just wanted it on the record because, that's our intention. We got in a little trouble with the bill last year that affected current contracts. So our intention is not to affect current contracts. Senator Hershey?
Madam Chair, is that satisfied? Some of the concern was about a 3-year extension that.
Yeah, they wanted 3 or 4. The sponsor wanted 1 and we agreed, we came to 2 and she agreed with 2.
Okay, but the prospective comments that you made should satisfy the
Yes.
concern for any existing contracts
Yes.
as well.
I just want to make sure you said sell. Where does it say not sell?
It's under the prohibition. These are lists of things that are prohibited. So the lead in is, if you go to,
Okay, I just want to make sure,
Okay.
I want to make sure I understand. Okay. Senator Reedy.
So I'm probably restating what Senator Hershey just said, but just to be sure, because I'm going to vote for the bill. Just there was a lot of question about making it a 3-year time lag, not 2. I know 2 is the compromise, I guess, between 1 and 3. But part of the prospective thing means that current contracts we're not touching, but
Right.
moving forward, I think that's good.
Moving
Okay,
forward.
all right.
All right, so we had a motion and a second. All favorable on the amended bill 952. Unanimous, thank you.
okay. The next bill on your list was held yesterday. This is the bill that would provide a grant to, it establishes the Reproductive Health Care Clinic Security Grant Program in the Governor's Office of, well, I'll skip that because the sponsors offered amendments to move this program to the Department of Health. So if you see in the reprint here that the program is maintained, the definition of healthcare of healthcare clinic is defined. That's also from the sponsor, and it's no longer in the governor's office of whatever that is called, but it's now going to be in the Department of Health with the sponsors amendments. And so the secretary would have control over the program.
This is the $500,000 for abortion clinics.
So I reached out to the housing department and Chuck Cook wrote that. I just sent it to you, David. He said, we have a category that might fit, but it's up to interpretation, camera, lighting, and related safety services. This application is for grants between $35,000 and $100,000 for collaborations to address illegal and dangerous activities from communities through lighting, camera, surveillance strategies, and related community services and technology. So the problem really is that for everything that SB 75 talks about, this might only address some of it. So it addressed like all of the exterior stuff, yada, 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 but like some of the more interior stuff, they may not qualify for the other grant that we approved.
When you go for a grant, you say what you want. You don't have to have all those things. What you need is what I think this bill does.
Mhm,
It's like one of my clinics has all glass.
mhm.
And even if we couldn't give them enough money, at least it would give them a little head start on getting bulletproof glass. That's all. That's what I'm looking at.
Senator Hayes, that grant program in,
Over in
were-
DACD?
that's $10 million that people can apply
Yeah,
for.
$10
This
million.
this is a total of 500,000.
Right,
So it's, it's a small
Smaller-
amount,
smaller
small
amount.
amount.
yeah.
We had a motion favorable. Did I have a second? Was there a second? Okay, so we have a motion, Senator Klausmeyer, second, Senator Guile.
Senator Hershey has a question.
Senator Hershey.
Thank you, Madam Chair. Just a question for my colleague. Was that specific to Senate Bill 430? Or so that when you asked the housing if they had something already, they were referring to Senate Bill 430 passing?
Right, so they said that Senate Bill 430 addresses most of these things, so they could apply to that $10 million grant to get it, but not all of the things that are included in Senate Bill 975.
All right, well, I'm gonna have to go with her close enough to doing anything that they'd want to do in this bill that we're talking about probably could get done in 430. And also note, again, this is only 500,000, which again, I guess makes it more palatable, but at the same time, I just don't see that that's a significant amount of money to make the type of changes that they have. And therefore, I'll just say that I think this is duplicative and not necessary with Senate Bill 430 already moving. So thanks.
I would like just to hold the bill, please. Thank you.
All right,
The last bill on this list.
this list, and it's a big bill, but it's big in weight, but it actually does the same thing all throughout the code, and I'll briefly describe what it does. Senate Bill 1056 makes consistent changes to the various laws that regulate the retail sale of tobacco products to individuals under the age of 21. Tobacco products include cigarettes, cigars, chewing tobacco, and electronic smoking devices. The bill also limits the sale of electronic smoking devices to licensed vape shops. In addition, licensed pharmacies will be prohibited from selling tobacco products. Each seller of a tobacco product must display their products behind the counter and only sell to individuals 21 or older. There are age verification procedures that apply to all the retailers, and at least 2 inspections of licensed tobacco retailers are required each year. Licensing fees for cigarette and electronic smoking devices only are also increased for their retailers. You have a reprint in front of you, but basically the same provisions apply to all 3 types of retailers, and that would be for cigarette retailers, other tobacco product retailers, as well as electronic smoking device retailers. There are 2 amendments to the bill from the sponsor. Amendment 1 is technical. The second amendment is clarifying and specifies that the increased fee revenues go to the health department or its designee for the inspections, reduces the number of mandated inspections to 1, adds an additional inspection if there's a violation, exempts sellers of premium cigars from the display requirements, and makes conforming changes to provisions of the Health General article that authorize local health department enforcement of illegal sales or tobacco products. We can go through this page by page, but that's pretty much what the amendments do. And again, if you've seen one set of provisions that apply to the cigarette retailers, you've seen the same set of provisions that apply to all the other retailers who are licensed. And again, it requires a lot of the changes in the bill strike references to electronic smoking device retailers because only vape shops will be allowed to sell them. So there'll no longer be a license for retailers to sell electronic smoking devices, whatever they're called.
I get a motion favorable. Thank you. Do I have a second? Thank you. I have a motion and a second. Now I have Senator, wait a minute. Vice Chair Classmeyer had a question.
No, I just have a question. So the only place you're gonna be able to get a vape is in a vape shop.
Correct.
Okay, yesterday we talked about the pharmacies being far away. I mean, I have a lot of vapes around me, but I know there's other places that don't have vapes. So, I mean, we're really kind of like infringing on adults that, adults that are, want a vape. So I don't know what's the answer to that.
Well, if I may, vape shops are everywhere, not just around you. They are everywhere. And in fact, they're all racing to beat the other competitors into marketplaces. And so I can tell you in Montgomery County, there's a vape shop on every block now. But the purpose is that we're trying to keep vaping devices out of the hands of children by limiting them to vape shops that only allow 21-year-olds and older to come in and shop. We are giving adults ample access to the product, but we are definitely winnowing down the opportunity for kids to get hold of them in alternative locations. So that's the intent and the purpose.
Okay, thank you.
And yeah.
Who was next? Senator Reedy, you're next.
I just wanted to, before I had a concern and I wanted to see about an amendment, which I thought I would have here, but maybe we didn't get it ordered in time. It's very simple, but I'm real concerned about the ban on pharmacies and not being able to sell tobacco products. And I think that,
We're gonna need to hold the bill. I'm hearing from Sally. She wants us back on the floor. So
Okay.
we'll have to hold, we'll be voting tomorrow morning at 9. Does anybody have a problem with that? Tomorrow morning at 9? Senator Hershey, can you hold your question till tomorrow morning? Senator Hayes, can you hold your question till tomorrow morning? Thank you.